to be much closer to her family up in Michigan.
Yeah. Her roots are in Michigan.
Yes.
All right.
I'm just making sure we're live, and we are
much closer to her family up in Michigan.
Yeah, her roots are in Michigan.
So we are, Harold, we are officially live on
Excellent.
YouTube.
And we are much closer to her family up in Michigan. Okay, well, why don't I call the meeting to order?
So we are,
Mike, would it be a good idea to put everybody on mute or?
Yeah, that's a good idea.
Okay.
I just muted everybody, I think.
No, I don't see the, Mike, would it be a good
It's
idea to put
reverberant.
everybody on mute or?
Yeah, that's a good idea.
Okay, and I am muted myself. So why don't I call the meeting to order? Certainly glad, let's see, we have 12, 17 people on so far. Hopefully we may get one or two more to join us. So glad that you could all make it. Let me read a statement that Mike had given to me. So until further notice, meetings of the Commission on Family Services will be held electronically, with the majority of the members participating via remote access in order to comply with the State of Illinois Gubernatorial Disaster Proclamation. Members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Michael Charley with the Skokie Health Department, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. The written comments also may be submitted by email to, it's citizens comments, that's one word, at skokie.org, by mail to Village of Skokie, attention Michael Charley, Director of Health and Human Services, at 5127 Oakton Street, Skokie, Illinois, 60077, or via the Village's drop box located by the public entrance to Village Hall. So with that, usually the first thing that we do at the beginning of a meeting is approval of minutes. However, that takes us back a year ago, and I don't believe we quite remember what even transpired then. The minutes were what I had that Mike had found in Beth's files were only partially completed. So we'll skip the minutes. So I'd like to start with some welcoming comments, and then we'll move on to the other items on the agenda. So first, again, welcome to our first Commission on Family Services meeting in 1 year. There have been a few happenings, as you well know, since our last commission meeting. For one thing, there's been this thing called COVID-19, and it's certainly changed our lives and how we do business. And it's also significantly impacted the village. I hope you all, your family, friends, have stayed well throughout the pandemic. And let's all get that vaccine as soon as it's available to you. The Skokie Department of Health and Human Services has done a remarkable job tracking COVID cases, keeping us informed, inoculating residents and employees working in the village, and assisting families who have been affected by the virus or by the economic impact of the virus. I'm sure Mike and Brian will fill us in detail in their reports. So let me tell you, particularly for the newer members or new members on the commission, a little bit about our commission. The purpose of our commission on family services is to provide a forum for focus on a wide range of issues concerning Skokie's most vulnerable citizens. Recommendations on policies, programs, and procedures are made to the mayor and the board of trustees. And of course, we have as a liaison one member of the board of trustees, Edie Sucker, here with us. Our mission statement is to facilitate improvement in the quality of life for Skokie's most vulnerable persons, regardless of age, physical well-being, or socioeconomic status through public information, education, and advocacy. So our meetings are normally the first Wednesday of every month, except for July, August, and January. It's at 7 p.m. in the Skokie Village Hall. And as noted in my statement before, we'll be meeting virtually until it's deemed safe enough to meet in public. Any questions? Okay, let me go on. So I'm sorry, did anybody raise their hand? I didn't see. Okay. Talk about some of the major things that we've done in the past. We've had biannual, the commission has participated with the village, Skokie Library, the Skokie Park District, and a number of nonprofit organizations and service providers to hold the Boomers and Beyond Community Resource Fair. At the last event, we had more than 40 vendors, a half dozen speakers, and over 300 people attended. I'd consider that a very successful event. We've assisted the Human Services Department and other community partners by sponsoring education programs for the community on various topics. Some of these have been held over at the library. Each summer, we've assisted with the Produce Initiative, where commissioners and other volunteers have collected produce from vendors at the Skokie Farmers Market, and it's given to the Niles Township Food Pantry. 2 years ago, we collected over 4,000 pounds of produce during the summer months. Again, we'd consider that a very successful activity that we participated in. We have commissioners who serve on other committees and boards and act as liaisons to our commission. And this allows cross-fertilization of ideas and communications of community events. Let's see, is Nicole here? I can't see. Oh, there. Okay. One of the connections that we have is with the Family Engagement Skokie Resilient Community Collaborative, SRCC. And a little later when we have reports, Nicole had asked if she can talk a bit about this. So certainly at that point. When we last met in March 2020, we had several new members attend the commission meeting, and subsequently, several more members have joined us, which is absolutely terrific. And this is the first time, our first opportunity for us to all get together and get to know each other. So in a moment, what I'd like to do is go around the virtual room and have each commissioner introduce themselves. So you please say how long you've been a resident of Skokie, how long you've been on the commission, and then if you wish, you can also tell us a little bit about your family or your occupation or why you joined the commission. Before we begin, I do want to express my sorrow for the passing of Angelo Militello, a commissioner who we all had deep respect for. Angelo passed away on December 27th, and he had been a teacher and a school administrator at Ridgewood High School for 33 years. He worked 10 years on the staff of the Jewish Children and Family Services. He was a strong advocate for teens and young adults, and he was our commission's liaison to Land 41 and the Niles Township Youth Coalition. And he always provided sage advice to our commission. So he's certainly somebody we're going to miss. So I've probably gone on a little too long, and this would be a good time to begin introductions, and that'll be followed by reports by Mike Charlie and by Brian McHugh.
Hey, Harold,
and Nicole, yes.
one quick thing. And this is more my fault than anything else, but I think maybe before we move on, we should probably just, although it's not on the agenda, approve the agenda. So maybe we can just vote to approve the agenda just so we have it noted in the record.
Okay, and that's fine. I entertain a motion to approve the agenda.
So moved.
Okay, Wendy and who second? Okay, so Shaun, in favor? Any objections? Okay, motion passes. So let's see, usually we go around the table. In this case, it's kind of a virtual table. Would anybody object? I put up a list of participants on the screen, and if I kind of call out names as I head down the list,
Good idea.
Okay, and remember, you will have to unmute yourself to talk. So why don't we start with Heather?
My name is Heather O'Donnell. I've lived in Skokie for 12 years, and I've been on the commission for about 7 years. I'm married. I have two furry children, and I'm a medical social worker for quite a few years. Welcome to all the new people.
Very nice. And you've been an important part of our commission, and thank you for all you've helped. Shaun?
Hi, my name is Shaun Jose. I have been a Skokie resident for actually 19 years, actually. So, and I have been with this commission right from the beginning of this commission. I was part of another commission, but it was reorganized, and this commission, Family Service Commission, was formed, and then I was there right from the beginning. And I'm so happy that I have been part of so many activities. Like what our chair Harold said. In addition to that, I don't know whether Harold remember that we had the plantation. We before we started the produce collection, we ourselves had taken a lot in village, and we cultivated, and then we donated to the Niles Township Food Pantry. And for many years, I was part of the food produce also, until I had a small accident, and then I had to take a break for collecting those materials. Otherwise, usually Heather, Harold, and 2-3 of us were the regular people for this produce collection and dropping in the Niles Township Food Pantry. We took pride in that. And also, Harold, please, I am with your permission, I can say that we have been participating in the July 4th parade for all these years, and we were the regular people, with our participation. So we participated as commissioners of Division of Family Service Commission, and it was also fun for all these years, except last year, of course, we did not have that. So hopefully this year we will have that. I really look forward to attending in that parade. So we had a lot of fun activities. I am a social worker by profession, and I take very much pride in working with people and helping the people. It is my passion, and I am very happy to be in this commission, and I'm happy to continue my service. And I live a family. I have a wife and 2 children, 2 sons, college going sons. So I'm happy, and let's keep up the fun and move on.
Thank you so much for reminding me about the 4th of July parade. That was a lot of fun.
Sure.
Bonnie? I think you're on mute, Bonnie.
Hi, thank you. Sorry about that. So hi, everyone. This is my first meeting of this commission. I'm happy to be here. I've been a Skokie resident for almost 40 years now. I raised 3 daughters here who have since grown up and moved away. And I've got 8 grandchildren. I work for the Jewish United Fund, and I oversee their work, the work of the speakers, events, and missions departments. And I look forward to all the work that's going to get done here and getting to know all of you. So thank you.
Great. Welcome aboard.
Thank you.
Let's see who's, we already got, skips Ernie.
Unmute. I'm Ernie Oskin. I've been a resident of Skokie for over 45 years. I'm a LCSW, ACSW, Masters in School Psychology. I'm retired from the Army as a Lieutenant Colonel. I was a family advocacy, domestic violence therapist and social worker, and a child therapist. I saw children who were victims of child and sexual abuse. My wife is a clinical social worker. We have lived and brought up our children here in Skokie. 2 children, one is an attorney, one is a clinical nurse, and I take care of my grandchildren almost, 3 days a week. So I'm very busy taking care of my grandkids. And I'm very involved in the Skokie July 4th parade, which I've helped to lead for over the last 18 years, and been a Red Cross volunteer and do a lot of other volunteer work in the community.
Great. Thank you, Ernie. You and I got a lot in common. I, with my wife, babysit for our grandchildren 2 days a week. Joe.
Hey everybody, this is my second meeting. I was appointed last year and attended last year's March meeting, and then everything shut down. So happy to be back. I am a social worker also, retired a few years ago, worked about 40 years, most recently with CJE Senior Life at Lieberman Center. After I retired, I worked in the Wilmette Public Schools as an educator for a few years, and I'm now substitute teaching there. Let's see, what else can I say? Oh, I've lived in Skokie 18 years, and very happy to be on the commission.
Great. Well, good to see you again.
Thanks.
Lila, did I pronounce your name right?
Yes. Hi, my
Yeah.
name is Lila Iqbal, and I am a Skokie resident since the last 7 years, and I work as a research associate at UIC College of Dentistry, and I'm a foreign trained dentist and on my path of getting the dentist license here in Illinois. And in future, I would like to contribute towards my community because I'm more interested in community-based dentistry. So I'm more interested in learning more, because I'm a Skokie resident, so I would like to contribute in that way too. And I'm very excited to be here because this is my first meeting, and it is so nice to see everyone. And I am hoping to see everyone soon, live, face to face. So let's it's good to know each other.
Great. Well, again, welcome, and look forward to, I think there's a lot of exciting things we could be doing as a commission. So as soon as we could really get out and feel comfortable in public. Let's see. My apologies. Some names are jumping around over here. Melissa.
Hi, I'm Melissa. I have been a Skokie resident for about 13 years. I live here with my husband and 2 kids. I've been on the commission since February of last year. So I remember my second meeting in March being the ominous presentation by the health department about this virus that was coming. I am a social worker at North Shore Senior Center. Shout out to Brian McHugh because he helped train me when I was a student there. I am now a supervisor in the Senior Family Services Department, and I oversee the benefits program.
Nice. Nice. Thank you. Welcome. Mike.
Hi, I'm Mike Steele. I've lived in Skokie with my family, with my wife and 2 kids for about 6.5 years. I also joined the commission last year in February, so I attended one meeting and then I missed the March one. So it's nice to be back and see you all again. I'm a senior policy analyst at Chapin Hall at the University of Chicago, where I work across the country to help support various child welfare, juvenile justice, and public education institutions implement public policy. I'm also adjunct faculty at the university, where I teach geographic information systems and public health in the bioinformatics department. So I do a lot of data analytic work.
Cool. Thanks. Okay, welcome back. Nicole.
Hello, everyone. My name is Nicole Perry. I've lived in Skokie for 16 years. You might get Zoom bombed and at some point, because I have a little 4-year-old kid who likes to say hi to everybody when mommy's on meetings. And then I live here also with my husband and dog. And my other hat is I'm professor and chair of biology at Oakton Community College. So I've helped with connecting people on the commission with, if they haven't already been connected with initiatives that we have at Oakton. And as I'll share a little bit later, I've been the liaison from this commission to the Skokie Resilience Community Collaboration Consortium. I always mess up the name. I always know it by SRCC. So I'll share a little bit about what that is and what we do a little bit later. Thank you.
Thank you, Nicole. Wendy?
Hi, my name is Wendy Katz-Nelson. I was really happy to see those of you that I know and really happy to see all of you that I'm just meeting. I think at the last meeting we had, it was the week before I got married. So I have a new name now. And I grew up in Skokie. I got married March 15th, literally the day before everything shut down, right under the wire. I grew up in Skokie. I left for college when I was 17 and I was gone 20 years. And now I've been back for 7 years to raise my kids here and be back by my parents. I have been on the commission for 4 years now, I think. And what else? For my entire career, have been a paralegal, but unfortunately was laid off due to COVID, cuts in funding. And that's okay, because now I'm on a path to becoming a licensed realtor and trying a new career that I've always wanted to do. I'm also very involved in my kids' schools at Jane Stenson and Old Orchard Junior High. On the PTAs, I'm very involved on the board and various committees at my synagogue. And what else? I think that's enough. I'm just really happy to see you all. It's really good to see you.
And you're a very busy person. Welcome back.
Thank you.
And Yolanda.
Hello, everyone. Welcome, new members. My name is Yolanda Bender, and I have been living in Skokie for 7 years now. And I forgot what I was going to say. I've been on the board for just like a year now. And my background, I have a master's in gerontology. And by day, I work as an executive assistant, unfortunately laid off due to COVID-19, but still busy nonetheless. So.
Okay, well, glad to have you.
Thanks.
I think that's the commissioners. Why don't we, Brian and then Mike, introduce themselves. I think most people know you, Brian.
Thank you, Harold. It's good to see everybody. It's my first meeting. I've been with the village over 7 years. Love what I do here at the village. Love being with the village. Big shout out to Melissa with the work that she does at the North Shore Senior Center. It's been busy. Village never shut down. We kept rolling along during COVID. I think the Health and Human Service Division definitely became more busier in a lot of ways with everything that's been going on. So we keep pushing through. Beth Lindley was a great leader. We have a new great leader with Mike Charlie, new direction, new light. So we're just going to keep rolling and keep doing what we do.
Very good, Brian.
Thank you.
Mike?
So I'm really excited to be here tonight with y'all. First of all, I want to say I'm super impressed with everyone's background. I'm certainly not the smartest person in this virtual room. Your backgrounds are amazing. I see a lot of assets moving forward in regards to providing some guidance and support for the Health and Human Services Department. This is my first meeting, obviously. I've been with the village since middle of November 2020. Prior to starting with the village of Skokie, I spent about 25 years in public health, 17 years prior to this with the village of Oak Park, where I was the health director when I left. And then prior to that, I also spent some time with the Evanston Health Department, and then I began my public health career with the DuPage County Health Department. But personally, I have 3 kids and a wife, and we live in Park Ridge, so we're somewhat local. Starting here cut my commute by about 2/3, so I love it. And everyone's been super welcoming in Skokie, not only the residents, but my fellow village employees. And Brian, you're a suck up. I know the way you introduced me. So just looking forward to working with everyone. It's going to be great. Thanks.
Great. Well, we're certainly excited to have you on board with the village and looking forward to working with you. However, you have been warned that you have big shoes to fill. Beth was terrific. Everybody was certainly sorry to see her go. But as I mentioned before, while she felt bad about leaving, she also was excited about going back home. Yeah, Edie, do you think you can talk above the noise?
Yeah, I'm gonna try. There's lots of noise in my house because ice damming and there's fans and dehumidifier, so let me know if you can't hear me. I'm a trustee of the village of Human Edie sector, and I'm the liaison to this commission. I love we've been working closely together with COVID since we started. I'm also a clinical social worker. I work for JCFI Chicago. I'm the assistant director of the Northbrook office. And I'm happy to have Brian joining us. You also work together to get so many new members and to get some new energy. And I welcome back the experienced members. I won't say old members, the experienced members of the commission. And thank you for giving your time to this commission. And thank you, Harold, for being our chair.
Great.
Okay, will you able to hear me?
Pardon? You break up at times, and it's probably we can't hear the noise behind you, but you're breaking up probably because of the noise.
So you didn't hear what I said?
Two-thirds of it, yes.
Oh, well. Can I say it again? Can you? Well, thank you, everybody. Can you hear that?
Great. Well, Edie, you've been a big support for the commission all along. And we certainly appreciate all the help that you've brought to the commission. Did I miss anybody on the screen? No, I think I got everybody except myself. So just a real brief introduction about myself. I'm probably the one on this commission who has the most irrelevant background. First, I am retired. I worked for my career as a chemical engineer. I was with BP Corporation at the end of my career. The best way I was able to define what I accomplished in my career was the first half of my career, I polluted. In the second half of the career, I cleaned up. So it was probably pretty much a wash, but I really enjoyed what I was doing the whole time. And this has been a really nice experience for me on the commission. I've been a Skokie resident. I got everybody else beat over here. I grew up in Skokie, then moved out for a while when I married 43 years ago. We moved back to Skokie, so I've been nonstop in Skokie for 43 years now, but I add another 7 years on the back end or the front end for the time that I spent growing up in the village. Great place, as you all know, to live, to raise a family, and so forth. I do wear a number of other hats, but the commission is one that I enjoy quite a bit. So I won't go through all the other things that keep me full-time busy, other than, as Ernie had also described, Monday and Tuesdays are my babysitting days. My daughter has 3 children, lives up in Highland Park. So we head up there and just have a great time with the kids. Get as much dose of children as we can before they get too old and then spend all their time in school, which would be a shame. So here I am on the commission, and I'm looking forward to what should develop into a very good year for us. With that, did anybody have any last comments? Okay, why don't I turn it over then to Mike for his report as Director of Health and Human Services.
Thanks, Harold. So what I'd like to do is I did put together a presentation to provide some updates on some of the things that are going on in the Health and Human Services Department. And I'd like to go over those things with you guys tonight. So first of all, I've already introduced myself, so I'll skip that part. But here are some of the other things that I'd like to present tonight. Human Services is now Health and Human Services. Some Human Services more recent updates, and I do intend on providing some COVID-19 updates, since that seems to be a priority right now and really absorbing a lot of my time and a lot of the time of Health and Human Services. So as you all know, in the fall of 2020, Human Services officially became Health and Human Services. This was a decision that was made for various reasons. In the fall of 2020, not only did the public health director, Dr. Catherine Kennard, leave, but Beth Lindley also left sort of around the same time. And the decision was made to consolidate not only those 2 department directors, but it was already in the works what they were going to consolidate the Health and Human Services Department. The Human Services Department, of course, continues to offer some amazing programs, and this is not all of them. This is just a short list, but social service information and referrals. You know, we have 2 social workers. Brian's one of them. They deal with a variety of social service issues on a day-to-day basis, helping residents with any challenges they may have in the mental behavioral health aspects of their lives. We also have a senior transportation program. We have, I'm not going to have time tonight to go over each one of these programs, but there's more information available on the Human Services webpage. But we're in an assisted family program where we assist families in December, a benefit access program, senior health insurance program, senior income tax preparation program, which is going on right now. We have 82 seniors signed up to get assistance prior to tax day. We do run a mediation program, and we do well-being visits to homebound residents. Some more recent updates. In January 2020, we helped 16 Skokie residents get financial assistance with their mortgage and rent. This is a program where especially families impacted by the COVID-19 virus, you know, people who have lost jobs, people who are under undue hardships, they can apply and receive a significant amount of money to assist them with their rent or mortgage or utilities. Since COVID hit, we've done a lot of things in Human Services and in the Health Department to assist those a little more vulnerable. We started what's called the Senior Reassurance Program, where we've been reaching out to seniors week by week with phone calls and emails and assisting them in whatever way we can. We've also been meeting with refugees and members of groups like the Assyrian community at the ELL Center, providing them assistance during the COVID-19 outbreak. Like I said before, we have this AARP tax program that's currently ongoing, where for no cost, we provide them through this program volunteers who help people with their taxes. I just wanted to mention, because I think I saw somewhere that this group had also discussed vaping in the past, but I believe the Board of Health has made, I know they've made a recommendation to the mayor and the village manager to ban the sale of flavored e-cigarettes or vaping products. It's sort of pending, so it hasn't gone to the board yet, so more to follow on that. And then back in December, I just wanted to note, we have this wonderful program where we collect all the information on all of the more vulnerable people that we've dealt with over the past year, and we offer them some assistance during the holiday season and gift cards. So it's a wonderful program that Brian McHugh helps run, and it was another successful year. So I'm going to skip forward to COVID-19. If anyone has any questions, just unmute and say something, because as I'm giving the presentation, I can't see everybody. But I'd like to talk a little bit about COVID-19 and sort of where we're at with the village. First, I'd like to start off with some data. The total cases, these are confirmed cases in Skokie, are 5,486 so far, with 112 deaths. Our average cases per day, it's a 7-day moving average, is 10 cases per day. You'll see on the next page, I'll show you all a chart. Our 7-day moving average is certainly lower than it was back in November. And we've sort of steadied off. We've sort of hit a plateau over the last week or two. And when you do look at the chart on the next page, what I want you to keep in mind is that what you see on our chart is exactly what's happening in the state. So the data that I'm showing, if I showed this, planted the state chart over it, you'd see pretty similar trends. Our positivity rate, as last measured, was 2.68%. It's really the lowest positivity rate we've had since September 15th. And really, we've only seen that positivity rate during about 3 total weeks since the beginning of the pandemic. So things are looking better, but we certainly are encouraging residents not to become complacent. And I just threw Cook County's positivity rate in there just to kind of share that, there are areas of the county that have a much higher positivity rate than us. Like I always throw, I use this at the board meeting on Monday too, but like Cicero is much higher, and it's just because they have a bigger Hispanic population than Skokie. This is a chart I just wanted to show you. Back in November, we were at about 58 cases per day on average in the middle of the month, and you can see it's slowly, steadily declined to where we've kind of plateaued since about the middle of February. So hopefully with the vaccine and with people continuing good behaviors, hopefully we start to see this go lower and that start to increase and from here on out. Vaccine update. So residents that have questions about the vaccine, there's a ton of information on our website. There's frequently asked questions. That frequently asked questions document on a webpage, most people can go there and answer most of their questions. People can also subscribe to Skokie News by visiting the Skokie's website. It's a great source of information. We send out information every Tuesday. We do have a COVID-19 hotline, but I'd prefer that people go to our website than use the hotline. But certainly, if they have any questions, they can certainly ask those questions via that hotline or the COVID-19@skokie.org email. So where are we at? So we have a registration list. Anybody who resides in Skokie can fill out a survey and they'll be placed on a pre-registration list. We currently have had 32,000 Skokie residents apply. And these are Skokie residents that are 18 years of age and older. And we are currently vaccinating residents that qualify for state of Illinois vaccination phase 1A and 1B. It's an approach to vaccinating where those that are most at risk are vaccinated first. 1A are healthcare workers in long-term care, 1B being frontline essential workers and persons 65 and older, and I'll talk a little bit more about that, but I'll try to go as quick as I can through this so we can get to other things. What happens then is when we receive the vaccine, which we've only been receiving limited supplies, so it's not like we can just order 1,000 or 10,000 or 50,000 doses. We get what we get at this point because it's allocated per population size. So Skokie with a population of 63,000 is going to receive less than, say, the county of Cook, or well, we're pretty large, but or some of the larger county health departments. Again, the biggest factor in preventing Skokie from vaccinating quicker is really just not enough vaccine. So just to go through the phases really quickly, phase 1A, which was the highest priority, and this is the state set this with the CDC, is long-term care residents and staff. That's our assisted living facilities and places like that, and healthcare personnel. Phase 1B are again, 65 and older, the frontline essential workers. The governor, effective February 25th, also added a phase 1B part 2, saying that we could start vaccinating persons 16 to 64 with medical conditions. The challenge is that we have so many people in phase 1A and then the original phase 1B still to be vaccinated, that not only Skokie, but Oak Park, Evanston, Cook County, Lake County, DuPage County, pretty much all the county health departments and municipal health departments in the northeast side of the state have said, we are not moving to 1B part 2 until we can get some of the other 1A and 1B people vaccinated. And that's the approach that we're going to take. 1C, again, is we haven't gotten there, but it's other essential workers like non-frontline workers. And then phase 2 would be the rest of the population. So let's talk about the vaccine itself. So we've delivered 3,750 Pfizer doses to North Shore University Health System. So right in the onset of the vaccine rollout, the state had said that hospitals would receive a certain allocation out of our allocation. So we sent up to the North Shore system this many doses. Evanston sent them this many doses. Cook County sent them doses, and Lake County sent them doses. And they used those doses to vaccinate their healthcare personnel. Now here in Skokie, we've given 300 doses, transferred them to our two federally qualified health centers. Again, as you know, those federally qualified health centers primarily vaccinate underinsured and or uninsured, which is an important part of our population. In addition, we've administered, and I want to make sure I make this clear, this is an approximate number because I've added what I think we administered today, but I won't really have an accurate count until probably tomorrow morning, but around 9,486 doses with 5,600 first doses and 3,800 second doses. Again, we continue to administer the vaccine as soon as we get it. We don't hold on to it. We are not stockpiling it. There's been weeks where we're so close on second doses that we've had to be really careful, but so far we've been pretty good with keeping our inventory. I mean, we've literally at the end of the week had like 50 doses. So we've been delivering all of our doses as quickly as possible. Now, what about Johnson & Johnson? So the FDA issued the emergency use authorization. It's a single dose vaccine. It only requires refrigeration, which is awesome because the Pfizer up until the last week would require ultra cold frozen temperatures, although they've changed to say you can store, I think, up to 2 weeks the Pfizer at like standard frozen temperatures now. 18 years and older on this vaccine. Now here's the hitch. Some people are going to say, well, it's only 72% effective in the US, 66% globally versus the 94 and 95% for Pfizer and Moderna. But just remember that this vaccine, the trial was in a much different time than the Moderna and Pfizer. It was actually later when there were variants. So I'd be curious to see how well Pfizer and Moderna would have done if there were the different variants available. The good news is it's 85% effective against severe disease and 100% effective at preventing death. So I think to the public, the health department is going to strongly encourage people get any vaccine that's available because ultimately the more vaccine that we can get into people, the quicker we're going to get through this pandemic. According to the state, the vaccine is going to be shipped immediately. From what I heard, they're going to get some doses next week. So we could get doses as early as next week here at the health department, but I won't know our allocation until Thursday. They do promise 100 million doses for the first half of 21. So it'll be interesting to see how they roll it out. And this is the message. Vaccine experts agree that all vaccines provide a very good protection, but the most important measure, which is whether they keep people from getting seriously ill. All three are really good and amazing vaccines to give. So I wanted to go over our vaccine clinic site really quickly. And I apologize that this is kind of a long presentation for the group, but our primary vaccination clinic is 7770 Frontage Road. I will say that pretty much most of our vaccines have been administered here, but we have been going out to group homes. We've gone out to about 30 group homes to administer second doses. And our long-term care facilities are all being serviced by the Walgreens Federal Vaccine Program. All 7 of our long-term care facilities. So we haven't had to go into those facilities. Our facility is located at that arrow. The circle is Village Hall where I'm standing right now. This is sort of what our clinic looks like. People walk through check-in and staging and then to the vaccinators, and then they go into an observation area. Here's some pictures. So if people walk into our clinic, this is sort of what it looks like, empty. People walk into the check-in right here. And then they go into the staging area, which is right behind it. And usually we have like nobody in the staging area because we push people through check-in almost directly into a vaccinator. In and out of our clinic, you're talking about 30 minutes. So it's a really quick process and efficient. This is just a picture of the vaccinators. We usually have a vaccinator and a vaccinator assistant. The vaccinator assistant is taking notes. They're making sure that the person's vaccination card gets the appropriate lot number and expiration date. They're making sure that they collect the data that's needed in order to push the vaccine information up into the state's vaccination database. This is just another view of the vaccinators' positions. This is sort of it in action. This is actually a really small clinic we ran because we usually have all these tables full of vaccinators. And the last thing, until everyone's vaccinated and we have herd immunity, we're encouraging people to wear a mask, watch your distance, and wash your hands. So with that said, I'm going to stop this presentation. And if anybody has any questions, I'd be more than happy to answer any questions about COVID-19 or about some of the programs we run or anything that you may have. I think Bonnie has a question. I don't know. Let me unmute your mic, Bonnie.
Okay, sorry again. Thank you. Thanks for that presentation. I do have a question about the vaccines. I've seen that about Johnson & Johnson, that it's what you just said, that it's 85% effective against severe disease and 100% effective against death. What are those statistics for the Moderna and Pfizer vaccines? I've seen also what you just said, that they're 95 efficacy, 95%, but I haven't seen it broken down to, you know, those other statistics about how they rate at preventing severe disease and death. Okay, you're on mute now.
No, you know, I didn't bring that data with me, Bonnie. I'd probably have to go back and look it up. I actually do have a spreadsheet downstairs that kind of compares the different vaccines. Unfortunately, I didn't bring it up with me. I'm sorry.
Okay, thank you.
Any other questions?
I think Wendy.
Yeah, Wendy.
Thank you. Mike, I'm wondering if you could please talk about our supply. You know, is it proportionate to the rest of the county, or are we? I know that there was sort of like an overall supply issue, certainly around the time of the bad weather that was nationwide, but are we expecting to be sort of on track with, you know, other places that have supply coming in?
Yeah, so the state's distribution plan is a population-based distribution plan. And there are a few exceptions to that rule, and I can talk about one or two of those. But in general, the amount of vaccine that we receive, or the Evanston Health Department receives, or the Oak Park Health Department receives, or Cook County or DuPage County is population based. So they're getting it based upon their population. So whatever ratio that is, that's what we've been getting. There are a few areas, but that's to the county health departments. I mean, the federal program is also distributing vaccine directly to Walgreens. The National Guard is out at certain locations where the data provides evidence that those areas are much more at risk because of the population. But in general, we're getting pretty much the same amount of vaccine as, let's say, like Evanston's about 10,000 more in population, but maybe slightly less than Evanston. So it's population based.
Great. Any other questions for Mike? Yeah. Can you tell me your name? You'll have to unmute. Unmute.
It's Jaime Garcia.
Oh, Jaime. Okay.
Yeah. I would just like to show my appreciation for the people working at the vaccinations site. They're very knowledgeable. We were there fast. Everybody was friendly. And I would like to make sure that everybody knows that we appreciate what they're doing for us. They were really good. It took us longer to go to the place than to get the vaccination. Pre-registration went well. Just tell your name, what time is your appointment. You get in. There's like 18 stations of nurses waiting. There was no line. I mean, it was so fast. Everybody was friendly, very efficient, and we need to tell them how we appreciate what they're doing.
And I just want to say that means so much to us. Even this morning on a call I had with the hospital system, there were a couple schools that participated, and they were very thankful too, because we were able to vaccinate many of our school educators in town. And it really means a lot for the morale of the health department, because we've been dealing with this for the last year and it's been a lot of work. So thanks. Appreciate that.
And I definitely want to second what Jaime said. I gone for my first, tomorrow I go for my second. First time, an incredibly efficient operation, and very, very friendly and understanding people. So
I got my second.
Great. Okay. And obviously encourage everybody who's eligible to get their vaccinations. You do it both for yourself, but even more so, you do it for everybody else. So you reduce the risk of, if you get infected, even if you don't know it, of spreading it to somebody else. So you're doing it for the community, and that's the most generous thing that you could be doing.
See, Wendy, you're an advanced Zoom user because you use the little hand.
Oh, thank you. Well, I learned a lot this pandemic. Speaking of the volunteers, I wanted to ask, I just today received an email in response to my application to be a volunteer at the clinic. Mm-hmm. And I'm wondering if you guys are fully, do you have enough volunteers? Do you still need more? And how does one go about finding that information if they also want to become a volunteer at the clinic?
Sure. So, and I actually had that slide in my presentation and removed it at the last minute, but we have, so those wanting to volunteer, we're looking primarily for medical professionals. We need vaccinators and pharmacists, and vaccinator assistants doesn't really need to be medical, but people wanting to volunteer, what they would do is go to the Medical Reserve Corps webpage of the Skokie Village website. And there's an application there. So people would submit an application, and then there's also direction within the application or on the site that they also have to go to the Illinois Helps webpage and apply there. They would find the Village of Skokie in the Helps page and apply. And people got to go through a background check, and there's a couple of little steps you got to go through. But yeah, then what we were doing with volunteers is we actually have 60 last time I checked, about 60 additional medical people that had applied, which is an amazing turnout. What we'll be doing then is we'll be sending out emails frequently, inviting the volunteers to participate in our clinic. And what we've been doing primarily is we have an agreement with the Oakton Community College Nursing Program. And we're also working with another university, and until the agreement's set, I won't tell the university name, but we're working with another university with their nursing students. So we've had really good luck with we have 15 lines of service with having volunteers from the nursing students work as the vaccinators, and then we've been using Medical Reserve Corps people and our staff for our pharmacists. So it's worked out super well. But the big but is we're gonna have to expand, right? I mean, we're operating up to 3 days a week, about 5 hours a day, and it's not because that's all we can do. It's just that that's all the vaccine we've got. So once we expand the clinic, we certainly are going to start using our volunteers more.
Can I say something in response to that? I wonder, I haven't seen a ton of publicity looking for those volunteers. I happened to hear about it because another parent posted something like in an unofficial capacity in like a Skokie parent Facebook page. But I wonder if, if a more, direct call for medical volunteers was put out, if that might be beneficial, because I just sort of heard of it by happenstance.
Yeah, we've been using our webpage and the Skokie News, and we're considering pushing it out through the schools also. So yeah, I mean, we can always do a better job with that, Wendy. Thanks.
I have a question. Can you say anything about people and or seniors who are not online in terms of getting appointments? Is there any plan for calling people, at least using on the telephone?
Yeah, so with people who are seniors who don't have internet access to register, they can call the COVID-19 hotline or the village, and the village will walk them through over the phone and register for them. And then what happens is that we know when we get to a point in the registration list, when there's somebody that doesn't have an email address, or sometimes we'll put in the village email address, then we know we help the senior. We are calling the seniors up and walking them through the registration process. So we are like trying to handhold, help them out, walk them through the process to make it as easy as possible.
Okay, thanks.
Great. How about, Mike, if it's okay with you, maybe one more question, if there are any more questions over here? Not seeing any questions. Thank you very much, Mike. And really look forward to working very closely with you as chair of the commission. Brian, would you like to take the mic and give a report on
Want me to sing?
Human Services?
I don't, it's been a little bit at times overwhelming, dealing with all that's been going on. A lot of people that we've come across have really been hit hard, both health-wise and economically, as well as emotionally and mentally, from just dealing with, over the past year of something that we've never come across in a long time, something new to a lot of us. We just, we got to hold each other and support each other through this, and we can get through that together. So that's all I have to add.
Great.
But I should reframe and say not hold each other, but stand 6 feet away from each other and be supportive of each other.
Yeah.
Wash our hands and wear a mask as we're doing it.
Right. Well, I think we're making exceptionally good progress. Obviously, we want to make sure that behaviors don't change again and people give up some of the distancing that they're supposed to be doing and wearing masks, and that we don't get back to where we were just a couple months ago. So hopefully we're all heading in the right direction. With that, Nicole, would you like to talk about the SRCC and what they've been doing or you've been doing with them?
I can certainly do that. So the SRCC, or the Skokie Resilience Community Collaborative, was an organization that was put together probably about 2.5 years ago. And it includes representatives from education, so District 65, 73 and a half, I believe 73 was in on it, is there. Obviously, I've got the Oakton connection, and then a number of District 219. So education's represented, a number of mental health organizations in the area, and some public health community organizations, and so places like Skokie Health Department and Erie Medical Care and a few other health organizations. And the collaborative was established to help educate and train and deal with the problem of ACEs, or adverse childhood events, in Skokie. So there are similar commissions, collaboratives that have been developed in other communities in the area. Evanston has a fairly strong ACEs commission or collaborative. There's a few others. Cicero has one. And this SRC has been meeting with a group from the state that also oversees adverse childhood events education as well, and has gotten numerous funding from the state. When we last met each other or talked to each other in March, the SRC collaborative was going to participate in a 3-day ACE interface training. So it was 3 long days of understanding how to communicate with people and to understand what ACEs are and the impact that ACEs have on the community. So as a side note, if you are not familiar with ACEs, I'll throw in a minute or so, I'll throw up a link in a couple of links in the chat. One to Nadine Burke-Harris's TED Talk. We watched that as a commission a few years ago when this ACEs started, or when Skokie started thinking about how to address ACEs as a community and as a commission. And then a link to her book, The Deepest Well. And both of those kind of illustrate how ACEs can impact overall public health outcomes. So that being said, this SRC group was doing ACE interface training, and we literally finished it up on the Friday before everything shut down. So like the Friday before Wendy got married, we were finishing up this ACE interface training with the idea of taking that training out into the community and going out to different organizations in the community to help them understand the impact of ACEs. And I will say that the initial ACEs study did not include anything like a pandemic in it. But I am sure that 10, 20 years from now, we'll be seeing the impact of this on mental health and public health in general, even more so than what we've seen in the last year. So that being said, the SRCC had received funding from the Skokie Communities Foundation to present, to sponsor the training, and then also to present that out to the community. There has been about 12 presentations to over 400 people who work and live in Skokie. If you know anyone or you have any connections to anyone who you think might want to see an ACEs training, so basically it's a 2.5 hour to 8 hour training, depending on what the group is or what the needs are for the group. A training that can be done by anyone who is trained at this ACEs interface training about a year ago. I was one of them. There were numerous others in the village. There were about 30 of us that were trained at that. So if you know of anyone who you think would benefit from that training and you haven't seen it or you'd like to see it, please let me know and I can reach out to the group and set something up, or I could maybe do it. I think that pretty much summarizes what I've been doing with the group, and then I've been reporting back to the commission and on what the group has been doing. We've only met once virtually, or yeah, once virtually, twice virtually, sorry, since the pandemic started. So we're just kind of getting back up into meeting quarterly now.
Thank you, Nicole. Appreciate that, and all that you've done through SRCC and just with the commission in the past. We also Angelo used to report back on Land 41 and the Niles Township youth. Maybe sometime in the future we'll have somebody who will be able to liaison with those groups to keep us appraised of what's happening there. Okay, that completes the reports part. Old business, which is the next item on the agenda, there is none. I mean, it would be ancient business if there was, since that dates more than a year back. New business, I just put a few topics on the agenda, and I don't particularly want to spend, or didn't plan to spend much time on any of these. But I'll make a couple comments, and then certainly if anybody wants to say something in regard to these initiatives, please raise your hand or speak up. The produce initiative, my hope, and of course the the Health and Human Services group is going to have to make the determination, but I hope it'll be safe to be able to be back in the farmers market during the summer. We'll be outdoors to help with produce collection and restart the initiative. I believe the need is even greater now with all of the economic impacts of the COVID, to get the need for food assistance is greater, and therefore our need to be able to move produce, surplus produce from the farmers market to the Niles Township Food Pantry would be significant. Anybody? Yes, Wendy.
Who did you say is going to make the determination about whether the produce initiative is going to happen this year?
Well, I believe the village will have to, and it'll probably be, and Mike may correct me, but it'll probably be the Health and Human Services Department, which would make a determination if it was safe to for us to participate in that.
Yeah, it'll be likely based upon the data, right? And what the governor's office is saying about that type of event, so.
Okay, I mean, I know that the food pantry was really missing it this year. And, you know, as you mentioned, Harold, it's so beneficial and helpful to the residents. And it's like almost adding salt on the wound, right? On top of the pandemic, one of the things that provided fresh produce, which is so coveted, also got cut out. So it would be nice if there was a way to bring that component back, both, for the health of the food pantry clients and just maybe the overall morale of everyone. Yeah.
Well, the hope is that the president's correct in that by the end of May, everybody who will want a vaccine will have a vaccine, and we will be outdoors. That put all those together should make it relatively safe, but I'm not the epidemiologist or the doctor to be able to make that call.
do you know when that maybe decision might be made? I don't know when the farmer's market starts.
Well, we usually didn't get significantly involved until early to mid-June. The farmers market may open a little earlier, assuming it would open on the same schedule, but they generally don't have a whole lot of produce early on. It's when things start getting ripe, so by June, you're going to start getting some of the fruits and a few of the vegetables that'll be out there. Okay, anything else? Boomers and Beyond Senior Resource Fair, so that's going to be a challenge. It usually takes, it kind of had gotten down to a routine, but even so, it was at least 8 months or so to do all the preparations to put together a resource fair. One of the principal people who had been involved, Greg Simnus, I believe was his name, is uncertain if he'll be able to be involved this year. So I'm going to take a guess, although I will inquire with a few people. I'm going to take a guess that we probably would not have the Boomers and Beyond Senior Resource Fair this year, and defer it to next year when we'll have adequate time to plan. Plus, even though we say with confidence that we're going to be in a good position with regard to COVID as the year progresses, we are talking about a vulnerable population. And again, whether Health and Human Services are going to conclude that it's safe to bring a bunch of seniors indoors to a fair such as that in maybe in the November timeframe would be, couldn't make that call now. And Mike, if I'm getting myself in hot water over here, please jump in.
No, I think that right now I think for an event like that, you can have up to 50 people.
Yeah.
At any one event. I think that's the maximum now. And that's Restore Illinois Phase 4. So I think if we continue to progress, I think that's as large as you could have. I'm not sure. Would you have it at Oakton? Is that where you had it?
We've typically had it at Oakton, yeah.
I don't want to add more work to anybody's plate, but maybe you guys want to consider some sort of virtual thing where you have speakers or offer it, something like that, instead of maybe you can bring the 40 participants and give them all an opportunity to speak to the seniors if they have access to like a Zoom or something. But it's gonna be tough. Seniors are that population that are most at risk, but who knows where you'll be in the fall,
Yeah, but I think you hit a key point there also. You and your departments are extremely loaded at this point, and probably for the near future at least. And this is not the time to, I believe, put another initiative on your plate, because even though the commission, some of the members of the commission did play a significant role in the planning for this event, a lot of it fell on your department's shoulders.
So as a North Shore Senior Center employee, I don't think that there should be an in-person fair, but if there was a possibility of doing something in its place, I think that would be helpful. Or if there's something that I can do or that we can do to help facilitate that. I know that we get a lot of calls from seniors asking about the resources that are available, especially right now when they need them. So even just if it's providing the resources and referrals, putting together some resources, I think that would be helpful. And I'd be willing to take part in that.
Yeah, well, I think the suggestion that that Micah made, that maybe we move this one in some fashion to Zoom, even though we know that some of the seniors may be challenged to be on a Zoom type of conference. Maybe there is a opportunity there which won't take a large amount of time to plan and execute. Something that might be an idea for a few of us to meet on. Anyways, let me, I think, well, we're already about 1 hour and 20 minutes into, so we probably should be getting near wrapping up. I want to talk a little bit about moving forward, and then unless there are significant comments, maybe after that would be a good time to wrap up our commission meeting. So one of the things that I would like to see, and of course this very much depends on the commission, is that in the next few months, we look into revisioning the purpose and the activities of our commission. Are we hitting the areas of biggest needs? We have a number of new members who have a very diverse and impressive background that may direct us into some other areas of needs of the community that we can help address. And obviously, time isn't going to permit us today to start investigating these kind of areas. But certainly, if you have ideas of how we can approach this task of revisioning where our commission should go, I'd like you to email me, email Mike or Brian with some of these ideas. And hopefully we could begin next month to start to discuss some thoughts of where we could be headed. If we get some ideas from commissioners, we could put it together, put it on the agenda, and use that as the beginning of discussions and see what comes out of it. I think, as I alluded to, we do need to start a little slowly with the commission because we do depend pretty heavily on staff support, and they're extremely loaded at this point. But I think over time, as the COVID hopefully quickly becomes something of history, we'll be able to get back to what we do well. And I'm looking forward to it. So basically, that's all I have. Mike, do you have any indication? Has any citizens from outside our commission tapped in?
I checked and just prior to the meeting, and there were no citizen comments, Harold.
Okay. Well, does anybody have any last thoughts before we move to adjourn? Without that, our next meeting, Mike, there might be an error on the agenda. You had the next meeting for April 6th. I believe April 7th is a Wednesday. Am I correct?
Yeah, I know on the agenda it says April 7th.
Oh, you do? Oh, okay. I must have an old thing here. Mine had shown April 6th. Okay, April 7th is fine.
Sorry.
No, that's fine. Okay, so our next meeting will be by Zoom again, April 7th. With that, entertain a motion to adjourn. Okay, Ernie, and seconded by Nicole. We stand adjourned. Thank you, everybody, for joining us today. I'm glad you all came back. And the new people, welcome again.
Thank you, everybody.
Thank you. Have a great
you.
night.
Everybody stay well.
Thank you. Nice to see everybody.